for folks that have done health insurance before, it's HMO, PPO, maybe point of service, but all of a sudden you start putting these prefixes on PPO and the agents are asking, not exactly sure, what does that mean? Good morning, insurance agents of the senior market. Welcome back to Near and Far. It is Monday, November 8th. So I just had a recent conversation with one of our agents who posed the question to me based upon product that was available in their market. Bill, which is better, LPPO or RPPO? Now, this is a question that many new agents ask when they get started in the Medicare business because, for folks that have done health insurance before, it's HMO, PPO, maybe point of service, but all of a sudden you start putting these prefixes on PPO and the agents are asking, not exactly sure, what does that mean? Help me, Bill, understand what that means specific to the Medicare business. So there's not an easy answer to the question in terms of which is better. So let's start by taking a look at the details around that question. So first, got to ask ourselves, what is an LPPO? What is an RPPO? Well, the difference is really simple. An RPPO means that the product is available in every county in a state. Now, LPPO, and a lot of carriers just refer to them as PPO. They don't bother putting the L in front of them. But again, if you see the term LPPO, it is any product that is available in a limited service area. So the L, I think I just did that backwards. You can't see it that way. Let me try that again. I'm trying to draw it. L stands for limited. Now, that means that PPO could be available just in one county, or it could be every single county in the state but one. All the LPPO means is it is not available in every county. Now, that doesn't mean that one is better than the other. So, one of the things that I pose to agents all the time when having this type of discussion is if a PPO product is available in the county where your client resides, who cares what other counties it's in? I mean, what does it matter? If I'm sitting in Allegheny County in Western PA and there's a PPO product that I like the benefits, covers my drugs, the docs, all that stuff, what do I care if it's available in Philadelphia County? I don't care. That's those people's issue. They can find appropriate plans for them. The next question, though, is how does it impact benefits? Now, this is really kind of a subtle next level thing just to think about in terms of longer term stuff. But an RPPO, being that they are required to offer product in every county in a state, it's possible that could lead to issues. Now, I don't mean fire and brimstone, floods, wrath of God type issues. But one thing to think about is that with an RPPO, if reimbursements in a particular county or maybe a couple counties are low, the insurance company's got to blend that all together because, again, if you've got an RPPO, it's available in every county in the state and the benefits are the same throughout all of those counties. So by having to blend those rates, so whatever the reimbursement is in Allegheny County, in Philadelphia County, in Erie County, in Dauphin County, where Harrisburg is, all of those blended together. Now, that can lead to a plan being less stable than a PPO product that can select the counties that it's offered in. It may be that you've got a product like, Aetna, for example, or Humana that says, I'm going to offer in these 4 to 6 counties, but, these 2 counties over here, the reimbursements are really low. Just not going to do that because it's going to bring the rest of the product down. Ultimately, though, as agents, you should be helping your client choose the plan that is best for them for that particular plan year. And if that plan goes downhill in terms of what's available for the next year, guess what? You got AEP, just like you got it right now, to select a new plan for the next year. So, that's kind of, my thoughts on LPPO versus RPPO. Ultimately, once you understand what it is, it doesn't really impact plan decision. It's like, okay, what's the best set of line items, a provider network, of prescription drugs that I can get my client in for this current plan year, and next year, take a look at it again during the AP, just like you're doing right now in your sales appointments. So we will be back with you on Wednesday, November 10th, bright and early at 7 a.m. I'm Bill. It's been Near and Far. We'll see you on Wednesday.